Hello, I'm Ben and I'm using UK Biobank data to answer the question, does your hip shape cause osteoarthritis? Hip OA is a very common condition describing degeneration of the joint shown on the right. It causes pain and affects roughly 10% of the population. It has no curative treatments, so it is important to understand risk factors so we can prevent it. Hip shape has long been proposed as a risk factor, in particular cam morphology, a bulging of the femoral head, pictured on the left. But the evidence for this association is all from observational studies. If we want to prevent OA by mitigating the consequences of hip shape, it's important to know that hip shape is causing OA, and this is difficult to assess with observational data. For example, an observational association is easily confounded. With regards to hip shape, we know activity in adolescence changes your hip shape, and activity also predisposes individuals to OA. Another problem with observational data is reverse causation. So in my example, it could be that OA changes an individual's hip shape as part of the disease process. This is what I wanted to tackle in my PhD. I aim to use Mendelian randomization, which is a form of instrumental variable analysis, using genetic loci for an exposure, in my case hip shape, to look for associations with an outcome, in my case hip OA. Theoretically, this removes the effects of confounding and provides evidence of a causal association. To achieve this, you need large sample sizes with genetic information and imaging data, and this is where UK Biobank came in. The extended imaging study in UK Biobank has now completed 40,000 hip DEXs. An example is shown on the left. Now, manual measurement of hip shape on these DEXs is not feasible because of the large numbers, so I've worked with collaborators to automate the placement of points around the bony outline using a machine learning approach, from which I could derive measures of hip shape. I then developed a program to take these points and calculate angles accurately and automatically. The picture on the right shows how my program calculates alpha angle, which is often used to define cam morphology. I then conducted genome-wide association studies to define genetic instruments for alpha angle, my measure of cam morphology. On the left are the Mendelian randomization results, which show no evidence of causal association between alpha angle and hip OA. On the right is the reverse analysis, where genetic instruments of hip OA show strong evidence of a causal association with alpha angle. From my work, it looks like genetic predisposition to OA causes alpha angle to increase, counter to my hypothesis. Currently, surgical trials are ongoing to look at correcting cam morphology through surgery to prevent OA. My work suggests they won't be successful. In addition, the work we have done automating these measures brings them one step closer to the clinic, whilst further enriching UK Biobank with our variables for other researchers. Thank you.